Welcome back to HealthView, everybody. Today I'm joined with Dr. Gibbons, and we're going to be talking about when is it the right time to go to the emergency room versus going to urgent care. Thanks for being here today.
Well, thanks for having me.
Absolutely. All right, so let's talk about urgent care. You know, this is kind of the sixth season, and people may be tempted to go straight to the ER with their issues. But what types of things can be treated at a LexMed urgent care?
Oh, sure. Well, there's a lot of things we can do, but this time of year, we're looking at cold and flu, right?
Yes.
And everybody wants to know if maybe they have COVID or not, and so we do a lot of that. Respiratory, cough, people that have earaches, the kids.
Yeah.
Then you got throwing up, stomach aches, maybe have a UTI, your back's hurting, sprained your ankle, those sort of things.
Yeah, kind of all across the board.
Yeah.
So I think a common misconception with urgent care is that you guys maybe don't have the same scope that the ER would have as far as work that you guys can do on patients. Can you tell me a little bit about where those limitations are?
Oh, sure. X-ray, CAT scan, ultrasound, a full lab. Those are all things that make it very convenient if you need to not only see your doctor, but also get testing done. We can accomplish all that at the same visit. It's like a traffic light. If the light is green, that would be urgent care, red, emergency department.
All right, I love that. That's a great analogy. Let's go through a couple of things, a couple of common things that people may deal with and kind of decide whether it would be smarter to go to the urgent care or the emergency room.
Sure.
All right, broken bone, or we're thinking there's a broken bone.
Well, it depends on the severity of it. If it's your femur, ER.
ER, for sure.
If it's your finger, urgent care.
What about a cough? This time of year, everyone's starting to get that little sick season cough.
Yeah, we do tons of cough.
Okay. If someone's experiencing chest pain, and maybe, that could be a sign of a heart attack, where's the line there of when to go to the urgent care versus going to the ER?
Sure, so if you think you're having a heart attack, if you're having chest pain, you're sweaty, you have nausea, it's going into your arm, maybe you have risk factors, you need to call 911 to go to the emergency department because time is critical. We say time is muscle. And so the quicker you get treatment, the better your outcome is going to be.
And then let's talk about strokes. What are the signs for a stroke? If it's not chest pain, what are the things that people are looking for, that signs that maybe they would be having a stroke? Because that would definitely be an emergency room situation.
Yeah, sure. So, there's a mnemonic, one's FAST, another one's BFAST. FAST would be like your face is drooping, your arms weak, maybe your speech, you can't understand or you
Slurring.
can't say your words. Time is important, so FAST, you need to go to the emergency department by ambulance. The BFAST just kind of speaks to if you're having, like you're unsteady, your balance is off, or maybe you lost vision in your eye. Those are all signs of a serious, life-threatening problem. And so ER is where you need to be.
Definitely ER, but those
Yeah.
smaller problems, those minor problems, and the day-to-day colds and stuff, you guys handle at the urgent care.
Yeah, we take care of lots of things, but from the patient's, for the patient's best interest, if it's really a life or limb threatening, you really need to go to the ER.
Understood. Well, Dr. Gibbons, thank you so much for being here today and teaching us about this.
You're welcome.